Welcome, everyone. Five Wishes is pleased to present today's webinar, Virtual Community Education and Outreach, How to Make Real Connections in Separate Locations. My name is Jennifer. It's my pleasure to facilitate. We are recording the call, and we did mute all participant lines. If you need help, please email fivewishes@compartners.com or send us a message in the chat box. If you're listening over the phone and you need help, you may press *0 for the operator. The presentation will last up to 60 minutes, and you are encouraged to ask questions throughout. Please submit a question by typing it into the chat box in the lower left corner of your screen, and be sure to click on the Send button. Do also take a look at the links box located above the chat area. Here are resources you can view, save, or print. Simply click on the link of your choice, and a separate window will open. This will not interfere with your viewing of the program. It is now my pleasure to introduce Paul Malley. Paul is the president of Aging with Dignity, a position he's held for 18 years. With more than 20 years of experience in the field of aging and advanced care planning, Paul is a national expert, frequent speaker, and advocate for quality and dignified care at the end of life. Welcome. I'll turn it over to you.
Thanks, Jennifer, and thank you to everyone joining us for this presentation, those who are with us live and in real time and those watching on a recording. Whether you've joined us for each of the Five Wishes Healthcare Practice Community webinars, or if this is your first, we're glad that you're with us. This Community of Practice webinar is designed especially for healthcare providers who use any part of the Five Wishes Advanced Care Planning program. Five Wishes has helped more than 40 million people express their wishes as a true grassroots program because of the efforts of people just like you. If your focus is more on outreach than patient care, you're still in the right place. Keep in mind that in addition to resources for healthcare clinicians and professionals, there are also resources for individuals, families, and non-healthcare organizations that can be found online at fivewishes.org or by calling or emailing us. We're always happy and grateful and love to hear from you and talk with you. Our aim is to help you serve your patients, your healthcare team, and your community in a way that honors each person's human dignity. And that term dignity can sometimes sound like a lofty goal that's hard to reach or hard to reach for. At the core, it really means feeling valued or worthy of respect. We all want that for ourselves, for those we serve in our work, and for those who we love. Here at Aging with Dignity and Five Wishes, for more than 20 years, we've seen healthcare providers coordinate all sorts of community outreach focused on advanced care planning. We've seen big and small presentations, employer workshops, collaborations with faith communities. It really runs the gamut. And it was beautiful to see that Five Wishes was not just helping patients and families in that way, but it was being used by healthcare providers as a way of fulfilling their own mission and identity and service to the people in the communities around them. It was a way of expanding their reach of dignity. So then, of course, came the challenges of life in a pandemic. Understandably, for many healthcare providers, the daily focus was on the most pressing and immediate clinical needs. Some pushed the pause button on advanced care planning outreach altogether, and others experimented with virtual outreach and tested other ways to connect and inspire people. So we're going to hear from Louise in this presentation, who will share some examples of one hospice's virtual outreach. On a personal note, I think back just a few months ago to when my own mom was seriously ill with COVID. She was in the hospital for about 2 weeks. Thankfully, she's well and home now. But while she was in the hospital, of course, we couldn't visit her family. But the spiritual care team at BayCare found a way to be present to her. Even though they also weren't able to be physically in the room with her, they called her each day. They called her by name. They remembered what her worries and her challenges were, and they were present with her even though there were restrictions. They found a way to do that. I was grateful for that, and I know that meant the world to my mom. And it was an example of a healthcare team finding a way around some restrictions to still be present, to still recognize and honor the human dignity of the person who they were caring for. In this case, it just happened to be my mom. So now we have the opportunity to learn from all the experimentation of the last year. We can look at what worked well, what was ineffective, and as we think about the future of advanced care planning outreach, we know it will continue to change and evolve, and will continue to adjust. As always, we're here to help and to find solutions and innovations along with you. We're grateful today to have with us Kathleen Taylor, who will guide us through this discussion. Kathleen is the Five Wishes Healthcare Advisor, and she brings more than 25 years of experience in advanced care planning, in patient care, as well as healthcare administration. Kathleen, I'll turn it to you.
Thank you, Paul. I appreciate the introduction. And thank you, everybody, for joining us today. We appreciate your time and your attention on this topic. As Paul mentioned, the Five Wishes practice community is something that we developed for folks that work in healthcare with the goal of helping you enhance your outcomes and elevate the practice of advanced care planning through sharing best practice stories. And I'm thrilled that we have one of those today, best practice story from YOLO Hospice to share about the topic that we have at hand. Keep in mind that the practice community and all of the resources that we provide, this is available to anyone at your organization. If you use any part of the Five Wishes program, you're in the practice community. So please share the resources with the people at your organizations. We want you to be successful. If you look under the links area on your screen right now, you will see a link to the practice community page of the Five Wishes website. So just keep that handy and send that to anybody in your organization who you think it might be helpful for. Our focus today is, of course, on virtual community outreach and education. And we're going to learn about a living best practice example of successful virtual community outreach and education, and talk about what are some of the things that we can consider that can help you make your virtual outreach efforts effective, meaningful, and measurable. As Jennifer mentioned, please submit your questions throughout. I'll remind you every once in a while, but I'd love it if something occurs to you, if you can just submit your question by typing into the chat box in the lower left corner of the screen, and be sure to click the send button. I'll be looking at those throughout, and we can incorporate them into the conversation today. We have talked before about the heightened awareness in advanced care planning over the last year, given what we've all been through, and those who work in healthcare have certainly been getting more questions and requests from families about advanced care planning over the last year. At this point, a year in, most people, most of us, know someone or know of someone who has been sick or had a close relative ourselves who was sick, and we've been through a year of everyone being more aware of the possibility of mortality, that of themselves and those they care about. So advanced care planning has become top of mind. That awareness has been part of every person's daily life, and there are now, sadly, millions of survivors out there. And we have the media to either thank or condemn, depending upon one's perspective, for covering the idea of advanced care planning and decision-making more than we have ever seen before. I remember a big bump in media attention during Terri Schiavo, but I don't remember seeing as much about advanced care planning ever as we have seen in the last year. One of the historical challenges with advanced care planning used to be people not knowing how to approach the topic with loved ones or with their communities. And now everyone has a reason. Everyone has a reason to talk about this, and they're ready to talk. We've mentioned this before on another webinar, But when the pandemic started, Five Wishes had about a 10-fold increase in requests from individuals. Now, I'm not talking about healthcare practices requesting advanced care planning information. I'm talking about the public requesting advanced care planning information. So it was a huge surge that we saw, and I think we are still now seeing the demand from the public at levels we haven't seen, again, for a very long time. So with that in mind, let's talk a little bit about why doing advanced care planning, outreach, and education. That's what the ACP stands for, by the way. People ask that, advanced care planning, outreach, and education is especially important now. We have several factors in this current moment that are making advanced care planning more important than I think maybe ever to address with everyone at every stage of life. As I mentioned, it's a critical time of heightened awareness, and advanced care planning is top of mind and has become really relevant to everyone. Also, there's a clinical need for advanced care planning. As always, there are people in our care who will need these decisions to be made, whether or not they are affected by the pandemic. I think people are now more aware of the decisions that need to be made should they be unable to speak for themselves. And of course, families and providers don't want to make decisions without knowing what someone would want. And advanced care planning can provide relief from this decisional burden and the chaotic confusion we've all been part of that can surround real-time crisis decisions. That's something that can help with clinician engagement and resilience, is making sure that we're relieving some of that decisional burden. And remember, it's my belief that activities that empower patients are pretty much always going to be good for business. And we know from multiple studies that advanced care planning has a direct impact on both care quality and costs, and it affects hospice referral rates, hospitalizations, satisfaction ratings, patient and provider communication, which is tied to various measures in reimbursement. Again, it's not perhaps the prime reason to do advanced care planning activities, but it certainly is a benefit that we know is proven and matters to the strategic planning folks of your organizations. So the well-known benefits of advanced care planning are more relevant and important in the context of COVID-19. If you need a refresher about the well-known benefits of advanced care planning, if you go to the practice community page that I mentioned earlier, when you have free time later after this webinar, there is a link with some research studies, and you can get all kinds of references if you're trying to make a case about advanced care planning at your organization. There's also a webinar about making a case for advanced care planning, so check that out too. With all of that said, over the last year, and I think you probably are all in attendance because you have lived this, many healthcare organizations stopped focusing on advanced care planning, outreach, and education. I think it's because we had to shift to new ways. We couldn't do the activities that we've always done for advanced care planning, outreach, and education. Events, health fairs, in-person presentations, those all got canceled. So what we needed and still need to do is to adjust, which is what healthcare professionals do pretty much every moment of every day, and find new ways to reach people. The shift from in-person to virtual outreach over the last year was really a shift from the way we've always done it to the way we now can do it. And that can really started out as a must. We went through a period of, we don't have another way to do this now. We must shift. But today I think we're going to review some things we've learned over the last year, and from this live, real example that show us that there are some benefits to virtual outreach that might shift us into seeing it as providing some additional opportunities that we didn't think about when we were doing it the way we always did. Virtual connection, virtual outreach is not going away. It's not. We'll get back to in-person activities and events, but the train has left the station, and virtual interactions are here to stay. People and organizations saw enough good and convenience in virtual activities over the last year that they've now chosen sometimes this as being a way of connecting. So I think we're not going to see this disappear. We may see it combine with some other things, but it's here, and I think given the access it promotes for certain folks, we need to figure out how to keep doing this and doing it well. The challenge is how to make virtual ways of connecting feel impactful and how to make the activities effective and meaningful. So today we're going to learn from someone who's done a beautiful job with this. We're going to hear from Louise Joyce from YOLO Hospice. She's the Director of Community Development for YOLO Hospice, and she'll celebrate 10 years with the organization this year. She was initially hired as the community liaison to provide education, resources, and support to community and referral partners. And she carefully nurtured and developed their community engagement activities over several years, creating a multi-pronged community development department. She now manages a team that includes community partner and referral relations, marketing, volunteer management, fundraising, community ambassadors, corporate and foundation grants, major gifts, community and fundraising events, and community education. So she's got the whole ball of wax there. Prior to her tenure at YOLO, Louise gained extensive experience working with both seniors and veterans in her role as a marketing director for the Californian and Acacia Glen Senior Apartments in Woodland, as well as her time at Brookdale Senior Living. So with all of that, I'm delighted to introduce Louise Joyce. Louise, welcome.
Thank you so much, Kathleen. It's an honor and a privilege to be here. I'm so grateful to be here with all of you. Thank you.
Well, we're very, very grateful to have you today. Can you start out by telling us just a little bit about YOLO Hospice and how YOLO typically did outreach before the pandemic? Like, what were the outreach activities that you were involved in before we got hit with this last year?
So sure, YOLO Hospice is one of the first nonprofit hospices founded in the Sacramento Valley, and we have the longest regional track record for serving those with a life-limiting illness in the counties of Sacramento, Yolo, Solano, Sutter, and Colusa. And we just celebrated, we're in our 42nd year right now, actually, so delighted to do that.
Wow.
And then, of course, before the pandemic, we have 2 community ambassadors, and they are out in the field checking in with community partners, referral partners every day. After the success of the Being More project in 2016, we learned that providing advanced care planning for our community at large, it did a couple of things. One, it helped raise our profile in our service area. But then 2, it also helped stabilize and increase our census, and that was a benefit that we were not anticipating. And I think, Kathleen, one of the most powerful stats for us, and we talked about this a little bit, was as a result of the Being More project, when I ran the referral numbers in 2017 to see who was our top referrer, typically it's a top referring physician. And the wonderful delight and surprise was that our top referrer for 2017 was not a referring physician, it was our families. And I remember sitting down with my CEO, Craig Dressang, and saying, I believe that we have empowered people to start the conversation about, hospice and end-of-life issues with their physicians through the Being More project. And so we were ecstatic about that, and we simply kept advanced care planning in our toolkit. And we added to the Being More project, we added a couple of other things. We took there's a 13-minute clip in Consider the Conversation 2, and it's just 13 minutes about interviewing, I think, 10 physicians on how it is that they're going to die. We took that clip, we put that in our toolkit. we created another workshop called What Happens After We Die, and really it was a physician, a psychic, a shaman, a nurse, all just kind of sharing of what they believed what would happen spiritually to the soul after it would die. And it was so fascinating. That workshop drew about 100 people also. And so we have all these advanced care planning tools in our toolkit. And then we would utilize it to work with our faith communities, our senior centers, to get the advanced care planning workshops landed at their venues. And then we would also utilize it if we wanted to increase our rapport with a specific facility in the service area. We would reach out to that facility that was in the same service area as the senior center and say, hey, we're doing this workshop. Our demographic is females 45 and older. Would you like to be our food sponsor? Your logo will go on the postcard. We'll announce you from the podium. You'll have a table with all of your materials at the event. And so that really, really works for us. And so we had all of that going on. So it was typical for us to have about 2 advanced care planning events in different service areas a month. The community ambassadors would lead that. Yeah.
That's a lot, even before the shift. And I just want to take a second. I don't know that everyone on the webinar right now is familiar with, you talked a lot about the Being Mortal project that you did in 2017 and how that was probably a main contributor to your referral source changing to family that year. The Being Mortal project was kind of a big partnership that happened between Atul Gawande wrote a book that year called Being Mortal, and it was about, of course, his experiences as a physician and what he had learned about care at the end of life and facing mortality at the end of life. A beautiful book. And there was a partnership between the Hospice Foundation of America and I believe PBS. So there was a documentary that was made. PBS did a lot of outreach, and they created the ability for organizations across the country to be Being Mortal outreach partners. So all kinds of organizations did what Louise was just talking about. They did Being Mortal events and had people come and watch pieces of the film and have conversation and do advanced care planning. So it was a concerted advanced care planning effort that allowed people to do a deep and expansive type of outreach around those kinds of ideas that year. So that's what that was, for those that didn't know. And I think what you saw, and correct me if I'm wrong, is that doing that kind of really deep, expansive, thoughtful community education and outreach around advanced care planning changed your referral patterns the year that you did it, which is wonderful to hear. So can you tell us a little bit about, in the past year, we just heard about how you were doing outreach before the pandemic. What kinds of shifts in demand for advanced care planning information did you see over the last year?
So our concern was, when COVID started to hit and we started to realize that all of our events were going to lose their venue and they were going to have to go to, a virtual platform. And not just our events, I mean the care for our patients and our families. We were utilizing Zoom in our YOLO Cares program, our palliative care program, but all of a sudden, as an organization, as many of us had to, we had to pivot so fast to get, telehealth to all of our patients and our clients. We also had to pivot to get all of our bereavement clients educated on how to use Zoom. We had to get all of our palliative patients and families educated on how to use Zoom. So there was this huge shift towards, really it was this moment of, we're losing our venues. If we're paying attention to what's happening in the rest of the world, we're losing our venues, and we had to really pivot to Zoom, and we had to do it pretty fast. And so the first 3 months of the pandemic, the whole community developments focus was to teach all families, patients, clients, bereavement clients how to utilize Zoom so that we could get them in there and provide the care for them. And that took about, I would say, 3 months. And also facilities, we offered up how to educate our facilities. And if family members had loved ones in facilities, we would teach them how to do Zoom. And so after the 3 months, once all that work was done, then the question came, okay, now back to advanced care planning. We're going to do this, and we're going to do it virtually. And so one of our challenges, and one of my challenges, being out in the community and doing all of the advanced care planning in person before COVID, I would always make an announcement and just really encourage anyone that actually completed their 5 wishes. So Aging with Dignity, 5 Wishes was the advanced care directive that we utilized for the whole Being Mortal project. And the other wonderful partner that we had at the table that has been with us through all of this is Alison Kent from Listen Inc. And you'll be seeing some of her beautiful graphics as we go along. And so she's a recording artist, and she would join us for all of these events. And so I would encourage the participants to please call me if they actually completed their 5 wishes. And, you know, with the Be Immortal project, we moved like 3,000 people over 33 venues in our service areas closer to the conversation. And I never got a phone call from anybody, like ever. And I know that there are amazing organizations out there that, the other hospice agencies, that they have people coming into the rooms and they're doing the work with them right there, and then they're leaving with the advanced care directive completed. And so we're not there yet. And so anyway, our thought process was, COVID gave us a moment of pause to think, so what is the barrier for people to complete the 5 wishes? And up until that point, we were providing it as a resource at our tables, and our community ambassadors also have it in their advanced care planning toolkit to utilize the DVD for an hour presentation. And then we just decided that maybe we need to do a more in-depth with Aging with Dignity and do a workshop, 1 wish at a time, to really drop down into the depth of the wishes. And we asked Alison from Listen Inc. to join us as a partner, and then of course, you know, your president Paul Malley to join as a partner. And for the we did a 6-week workshop in the last 6 months of 2020, and it was amazing. It was amazing to see everybody come to the table and work through the wishes.
Can you, I know we've got Paul here, which is wonderful. Since both of you were there, and again, there is virtually everyone, but since you were both part of the workshop, can you just kind of paint a picture for us and tell us what happened over this 5-part workshop?
Sure. I'll start, Paul, and then you can chime in. So we promoted the event with postcards into our demographic, and our demographic is female, 45 and older. They tend to refer their own their own parents, and then their spouse's parents into our palliative care program or our hospice program. And so we sent that out. We sent a postcard out, and it was real clear that it was going to be a 6-week workshop. Covering each wish, and then a summary workshop at the very end. And so we had 121 registrants from that postcard. Our max attendees at the time, we had 89 people coming into the rooms for the workshop. Now here's the piece that was important. Every time somebody RSVP'd for that workshop, they got a follow-up phone call from one of our community ambassadors saying, thank you for registering. We're looking forward to having you in the workshop. Are you familiar with Zoom? If the answer was no, the community ambassadors would teach them how to do Zoom so that they will be successful coming into the workshop. And we had an average of 56 for all 6 webinars. And it was just an absolute delight having everybody in there with us. Paul, do you want to add anything?
Sure. You know, my first thought is, I think back, Louise, when you first contacted us to suggest this format of 1 wish a week and a 1-hour webinar that would focus on each wish. I'll be honest with you, I thought, wow, I wonder if that's going to work. That seems like an awful lot of time to spend on each wish, and I wonder if we'll lose the attention of people. And I was really pleasantly surprised at how well it seemed to flow and how well it was received. And as you said, Louise, by the number of people that just consistently came back week after week for this 6-week session. And I think, well, number one, I would call out, Louise, what you already said, is that you looked at your community, you looked at outreach that you had already done, and you tried to identify what some of the hurdles were. And you identified that this Wish a Week would be the right approach for your community, and you were right. And I think in the flow of the workshops, what I loved was that the rest of that week, I would get a few emails or we would get phone calls at Aging with Dignity by some of the attendees who would say, I'm working through Wish One and I have a couple of questions. In one instance, I remember there was one woman who was in your region, Louise, in Sacramento area, and she shared the webinar link with her two sisters. One was in Colorado and the other was in Canada. And they were coming together each week to participate in this workshop and filling out their 5 wishes, wish by wish, week by week, along with everybody else. So there was a feeling of camaraderie, but togetherness, of being united in gathering every Thursday. For us Eastern, it was 1 o'clock in the afternoon. In Pacific time, it was 2 o'clock in the afternoon. It was 11 o'clock in the morning Pacific time. But there was a beautiful side effect to gathering this group each week and feeling connected and united in the purpose of it. I loved it.
Yes, we do.
And with
we
that,
love our Thursdays.
Every time you, both of you, when you talk about this workshop, what's funny is I get visuals in my head of it being, I see it as in person, because that's what I'm used to from doing in-person outreach for so many years. So what's interesting to me is how I can imagine the connections being made when you talk about it. It sounds very intimate. It sounds like people got very personal. And when I look at the graphic recording, and by the way, let's give a shout out again to Allison Kent of Listen Inc. for these beautiful images. When you look, these are the images that were captured in her graphic recording of what was being shared by participants in a virtual workshop. This is a virtual workshop, and the depth and personal nature of what you see in these graphics to me is just incredible. And since you were there, can you give us a little bit more of a feeling for what that was like, the things that were being shared as we roll through these beautiful images?
And logistically, the way that this would work is that as the presentation was going on, it was very similar to this webinar where participants were encouraged to add their questions in the chat box. And so Allison would monitor that chat box, and when the time came for Q&A, she had this graphic already prepared with the questions, and then we used this graphic as the Q&A back and forth. So you're right, Kathleen, that did add a connected feel to a virtual presentation, where normally in an in-person presentation, that time of Q&A is the time of engagement, right, where you're hearing what's on the minds of the people sitting in front of you. Well, this was a way of adding that personal connection and also validating and acknowledging the questions that were asked and formalizing them too, in a way by putting them in writing and then putting them in a graphic context. I think, and I don't mean to kind of bleed this to death, but there's something here. It was a way that that the virtual presentation still held on to a personal, a human element that was responding to what was on the minds of people, what they were concerned about, hearing them, acknowledging them, and putting them visually in front of all of us to be able to talk through.
Yeah.
I love the capture on these. Thank you for sharing about that. Louise, you talked a little bit already about what was different about planning this event from planning traditional in-person outreach events. And one of the things that you mentioned that I think people are going to be delighted that you're sharing this today is the check your tech element of your workshop. You talked about wanting to make sure that people were able to access Zoom and could participate in this without fumbling around with the technology. Can you talk a little bit more about how you did that and about your ambassadors and about the training, please?
Right, and so, you know, when we realized what was coming, you know, with COVID and that we were going to lose our venues, you know, the team and I sat down and, you know, we realized that we were going to have to utilize Zoom and we were going to have to teach everybody how to utilize Zoom. And so we realized that we needed a Check Your Tech document. And in the Check Your Tech document, basically what would happen is our community ambassadors would have it with them and they'd be calling somebody who had RSVP'd for an event. And so they would be calling and saying, thank you for RSVPing, you know, we're looking forward to receiving you. Are you familiar with Zoom? And if that person said no, then they would say, what device do you have? Do you have a laptop? Do you have a Mac? Do you have an iPhone? Do you have an Android? And whatever the device was that they had in this Check Your Tech booklet, the community ambassadors could just flip to that page and then they would walk them through the step-by-step for that person to get onto a Zoom meeting totally dependent on the device that they had in their hand, that they had in their home. Because the challenge is like we're trying to teach everyone else, you know, Zoom, but we also have to keep them safe and we have to keep them in their home. So what is the device that you have in your home? So I turned to my marketing person at the time and I went, okay. And she was the one who was kind of the lead on the whole Zoom thing. And I said, you know, Lorianne, I want you to go home for the whole day on Friday. And the only thing I want you to do is I want you to create a document that speaks to how to get everybody on Zoom dependent on the device that they have within their home. So that's iPhones, Androids, Macs, whatever it is, do all that research and then create this document. And so she came back on Monday with the document created. And so you're going to be sharing that today. So
yeah,
it was huge because, yeah.
Well, and just so everyone knows, if you're looking at this slide and also under the links area on the webinar platform, YOLO Hospice has been tremendously generous with all of us today. This full document, the Check Your Tech document for Zoom accessibility, they're making this available to everybody who's interested, everybody who's participating in the webinar today. So if you go to this link, which you see on the screen, and you also see under the links area of the webinar, it will ask you for a password. They're not collecting any information. They're just asking for a password. The password is 5 wishes, so that's it. You will get the full document that you can see how they covered every step of accessibility for every type of technology that someone might use to access Zoom. So it's tremendously helpful, and I think, as Louise said to me when she shared it, and I thanked her profusely, it really just keeps everybody from having to reinvent the same wheel. So thank you to YOLO for making that available. They've also made available the flyers that they use, the postcard for promoting the event, the flyers that they use for promoting the event. And there is a larger Check Your Tech document that was internal, that was for all of the people in the internal healthcare organization, making sure that they had a way, when she talked about the 3 months before the event and starting to get everybody geared up for doing virtual visits, that document is also available. So we've had a lot of questions so far from you about, will these resources be available? Yes, they are available. They are available at the link you see on the screen. Also, the 5 Wishes resources, you can find those at the Practice Community link. You can find the tools and resources. You can find the conversation guides for patients and families, for individuals and families, and other assorted and sundry things from 5 Wishes at the Practice Community page. So again, thanks, Louise. That's a big deal to make that available for all the participants today. Somebody has asked what platform was used. This was all via Zoom, correct? And even the graphic recording, those images were presented in Zoom. That was probably a screen share that Allison did in Zoom. So that's the platform. When you do your virtual sessions, how do you get the attendees their workbook, their 5 Wishes advanced directive? How did you get that to people?
Oh, that's wonderful. That was one of my favorite parts. 5 Wish Aging with Dignity has digital 5 Wishes. And so we simply provided a link to everybody that attended, and they would click on that link, and then they could download it into their laptop or whatever device they had. They could also print it off, and then if they came to the workshop and still hadn't done that, in the chat box we're loading the link to their digital 5 Wishes.
Great, thank you. Yeah, I think Paul, please say more about that.
I'm just going to add that option did work out well, and this was one of the first times that we used this new digital ability with a fillable PDF that we coordinated with YOLO Hospice so that each of those 5 Wishes that were created for their community had their customized branding, a message from YOLO Hospice on the back page. So again, what we were trying to do is find a way to reach everyone, to provide the document to them, to provide 5 Wishes to them, working within the reality of the restrictions that were in front of us, but also not just accepting the easiest technical way to get it done, but to think about what's the best technical way to get it done, but also retain the best elements that we have of connectedness with people, and for hospice, working with hospice to do the advanced care planning outreach in a way that also retained their outreach goals and supported their outreach goals with including their messaging still on 5 Wishes just as it was the year before.
We have a great question, which is actually where I was going to go next in our conversation anyway. The question from Michaela is, I'm just curious if you can speak to how you justified the time commitment and resources in the form of return on investment. Were there certain metrics that are considered successful? And again, she's mentioning this is a real challenge with advanced care planning work. So yes, it is. And we talked about some of that at the top of the presentation, what advanced care planning is directly related to in terms of outcomes. But Louise, can you tell us, what did you measure? What would you like to have measured, and what did you measure from these workshops?
So a couple of things. One, in regards to the resources. Here's the thing, advanced care planning workshops via Zoom are actually less labor intensive and require less time. Because if you can imagine, before COVID, my team would be going to a senior center. The place that the chairs and tables would already be set up, but they'd have to go in and land all of the pre and post surveys, all of our information, all of the discussion facilitators, placards. So there'd be a setup time before our participants even arrived. Then our participants would arrive, we would do the workshop, then the workshop would be over, and then my team would have to just break down and leave. And so there was a labor-intensive piece in there that we were more than happy to do, because we were definitely, people were just loving what we were doing and were more than happy to do it. But the actual virtual workshops, nobody is setting up a room. So it is more technical organizational skills. So there's like a meeting for about, half an hour to just kind of make sure, okay, we've got everything, going forward, postcards are out, the RSVPs are coming in. There's an audio-visual test before we launch the 6-week workshop. Everybody comes into the workshop 15 minutes beforehand. We're checking Allison's audio and visual. We're checking Paul's audio and visual, making sure his PowerPoint. But it's actually less labor intensive. The other challenge was, because of COVID, my community ambassadors who are always out in the field checking in on our referral partners and in the facilities, all of a sudden the facilities were shutting down saying, you can't come. You cannot come out. So their outreach shifted to phone and also Zoom for the referral partners. And so it was a lot more in-house with tech support. And I hope that helps answer that question. The other thing that we measured was you have the ability to run polls in Zoom. And so we would run a poll before and after each workshop to evaluate and gather feedback from our participants. And we do that at every event. We're always trying to figure out, how can we make it better? How can we make it better? And so some of our pre-poll questions were just simple. Did you attend last week's webinar? Because we wanted to make sure that if you were there for 5 Wish, you're following through on all wishes. If not, have you attended an advanced care planning workshop in the past? If yes, did you complete Wish 1? We're always asking them if they completed the previous Wish. And then we're always asking them how they heard about the workshop series. We're always looking at our return on investment for marketing via postcards, social media, flyers, all of that. And then at the end, we would run a post-poll question, which included, I would recommend this program to family and friends. Were there any parts of this program that were uncomfortable for you? Again, we're looking for barriers. Were there any parts of this program that were unclear? I am more comfortable with the topic of advanced care planning. Which part of the program was particularly helpful? And then the information in this program added to my knowledge and will be useful to me. The last piece of data that I reached out to Kenya for late yesterday evening was I needed to know from those polls, what were the top 3 barriers that our participants were sharing? And it's interesting, the top one, and this is from our workshop of 2020. We're going to be finishing our first workshop this Thursday, and then we're going to be doing another 6-week workshop in the last 6 months of 2021. But the top 3 barriers were not having enough time to complete the form, was the top one. Not being able to meet or get a witness, that's huge. And then unsure of wish preference. So, this information tells me we still have more work to do. Did that answer all of your questions, Kathleen, or do I need to?
I think that's very helpful.
Okay.
I think, we get this question a lot with 5 Wishes. I think advanced care planning has always been kind of a tricky thing to measure. It's been something that people have typically measured more output than they've measured outcomes. They've measured, how many completions and how many touches, and there's been a lot of counting how many, because it's been difficult for people to make the connection sometimes between doing the advanced care planning activities and patient and family outcomes, which is what we're really aiming at, community outcomes. Referrals are certainly an outcome. I mean, the fact that you knew from looking in 2017 at the referral base and that shifting to families, that is an outcome that you see from doing advanced care planning, outreach, and education. And there are lots of other ways to look at that and see a correlation, if not a direct result, which would require doing chart reviews to see who's got advanced care planning conversations and then what happened. And I think based on how many questions we get about that, that's probably something we'll focus on in a future webinar. And we'll continue to provide mentoring. If anybody's got questions about how you can do that specifically in the type of work that you do in your organization, give us a call. Call us at 5 Wishes. That's what we do, is mentor people and walk through some of this stuff. We do special projects all the time with organizations. If that's something that you want and you want a consultation, we can do those and talk to you about your workflow and how you measure the outputs and the outcomes of certain activities. So just to add on to the stuff you were saying, which was great, Louise, thank you for that. Just to touch on this again, people are saying they're having a little trouble with the YOLO link. Here's the link on your screen. The password is 5 wishes, just all one word with no spaces. If there is a technical issue, we will address that after the webinar and make sure that that is fixed, but I'm pretty sure that was working. It was working before the webinar, and I'll check and make sure that that's working afterwards so that everybody can access that. So we've talked about the event, we've talked about your measures, we've talked about the planning. What are the lessons that you learned? What do you wish that you knew before you started, and then what do you think you might do differently for virtual outreach and education?
You know, we really didn't know if people were going to show up for a virtual event. You know, there were so many changes happening in people's lives, so many devastating losses. You know, I mean, our frontline worker, I mean, it was just, I wasn't really sure if anybody even had the capacity to show up, even though 5 Wishes, Aging with Dignity, was reporting there's been a 10-fold increase. And we just kind of went, okay, well, there's the green light, you know, let's go. And just wasn't sure that anyone was going to show up. And then people did start showing up, and we would get pictures of families in like one household with the laptop on the kitchen table watching the webinar, and it was like, you know, oh my God. And I think, you know, I think the big lesson is, you know, for us is, you know, we are looked to provide this education. People do look to us for them to gain this clarity on who is it that I am going to ask to be my healthcare agent. There is still so much more education to be done. It's one of those conversations, because, you know, you shared about how it was tenfold for COVID-19. Well, you know, the Being Mortal Project was also a bit of a perfect storm, because Dr. Atul Gawande, he wrote that book. The End of Life Option Act for California was happening. And then Hospice Foundation of America created that wonderful opportunity for hospices nationwide to find that screening site within their locale, show the DVD of Being Mortal, and then have a discussion facilitated by the healthcare professionals afterwards. And one of the pieces that I wanted to add is a lot of the time, YOLO Hospice is not just out in the community as YOLO Hospice doing advanced care planning. We're partnering. The healthcare professionals that facilitate the discussion are our referral partners. They are the physicians from Dignity. They're the nurses from the nurse practitioners from Sutter. We reach out to our referral partners and ask them, do you have an hour to be with your community to be a discussion facilitator for the Being Mortal Project? So we're constantly engaging, and we don't want to do this alone. We do not want to do this alone. We know that the more partners that we have, the greater the impact is going to be. And so I just really feel that there will always be work to do around advanced care planning. And I think my lesson is we're probably never going to get there.
Yeah.
It's never going to,
well,
it's not a destination. It's about the journey.
That's true. And I think you're right. I think because this is, you know, the issue doesn't ever go away. We all have lifespans. We're all going to get to a point where it's time for us to make our wishes known and to have the rubber meet the road and see if that happens. So yeah, the work really won't ever be done, but I think we can get to a place where perhaps people are better prepared and educated. Real quick, I want to mention a couple of things, Louise, that you said to me, just so people understand this. When we talk about what virtual outreach and education, actually some of the benefits of virtual outreach and education over in-person, you know, I'm not saying in-person is going away, but one of the things you mentioned to me is that you had an 85% attendance rate out of your registrations, which like anybody who's been doing community events for a long time. 85% is crazy. That's crazy. I think most of the time, I don't know what the average is, but if you hit 50, I think you're jumping for joy. And you got an 85% attendance rate from people who registered. Do you think that's mostly because of the personal attention with the Check Your Tech calls?
Absolutely. I do, Kathleen. I really feel that every RSVP that comes into YOLO Hospice for an event, immediately they need to hear and know that there's a voice and a live person behind that RSVP. So when it comes in, Kenya and Liz will call and reach out so that that person can hear that there's a live person. And the thing that I'm always trying to be mindful of is, you know, our audience, a large part of it can be seniors. But, you know, when we say seniors, we have to be mindful of the fact that that person could be struggling with macular degeneration. They could have hearing issues. There could be some MCI going on. So you can imagine the amount of support that is needed to just get them in the room. So if it's just a postcard and they have to go online to register and then that's it to get them in the room, I just don't feel that that's going to happen. I feel like, you know, Kenya and Liz providing that support, that one-on-one attention, and then basically saying, you have any other questions after this call? Here's my number, give me a call. Always encouraging them to call and reach back out. Because the thing that COVID has done for us, you know, in hospice has increased the isolation almost tenfold also. So we're trying to reduce that isolation any place that we can.
To wrap us up, this has been wonderful, Louise. Thank you so much for this. And I want to ask one last, perhaps loaded question to wrap us up. What do you think, and you and I talked about this a little before, but tell us what you think is the most important thing to note about making a shift into doing virtual outreach and education?
To just use the technology as a tool, and it should never replace the person-to-person touch, ever. It's just a supportive tool. So it's kind of like in the background, but that person and that contact, face-to-face, phone call to phone call, needs to always be up front and to utilize technology as a tool. But in order to reach those that are suffering the most, we need to constantly be reaching out personally.
Yes, I think that's absolutely true. And I think when you go back and look at how you kept the personal touch throughout these events with the ambassadors and the Check Your Tech calls, I think when, you know, having the graphic recording and having those beautiful visuals for people to see during the workshop and after the workshop, because people were able to access this information. By the way, we talked about having a shelf life for events. People were able to go back and look at this after the event. All of this humanized it. It's just very clear to me that all of that humanized the events from top to bottom. So I think that's a huge lesson. And with that, I think we'll wrap up the bulk of our presentation. And Paul, just in closing, wonder if you might say a few words about keeping, you know, the mission of Five Wishes as a program of aging with dignity centers around maintaining humanity in all of our interactions between patients and families and providers and every place that those touch each other. Can you say just a few words maybe about keeping humanity in the interactions when the interactions are virtual?
Sure. And I think that's exactly why it was so important to highlight the work of YOLO Hospice, because, you know, quite frankly, the exact format of a six-part series might not translate to be the best thing for every community. But what I think does translate to be the best thing for every community is using technology as a tool, but also maintaining that person-to-person interaction. It's the same thread that connects what I mentioned at the top of the webinar with my mom being in the hospital and the spiritual care team at BayCare not letting the fact that they couldn't walk into the room stop them from interacting personally with my mom by name, responding to her individual needs. And whether that's an advanced care planning workshop, a spiritual care visit inside an acute care hospital, a discussion that happens at a physician office or outreach that's led by a physician, intertwining those two things, using the technology, must be combined in some way with that individual person-to-person connection. It amplifies the impact and makes it real. And that's what we hope everyone who participates in this discussion can carry forward and find a way to ingrain that thread in their outreach, regardless of what the format looks like.
Thank you. Yes, I think all of that is true. Just a few things for you all to keep in mind before we close, so don't leave yet. Keep in mind that the 5 Wishes patient education materials are a great tool for outreach and education events like we were discussing. Again, the link to the 5 Wishes program for healthcare page is under the links section here. These don't require you to do any real, Louise and Yolo did a lot of content development in terms of the events, but in terms of content for your patients and families and community, that's done for you with our patient education and outreach materials. In addition, please submit your ideas for future webinars. We do these for you. We'll always keep them free, and we do them for you to help you be more effective in what you're doing with the 5 Wishes program. So send your ideas in the chat box, and we will read all of them. And we're the only people who are going to see the ideas, so let it fly. And also, if you have a best practice story like Louise did today, if there's something that you've done with your 5 Wishes program that seems to be outstanding or is really successful and you'd like to share that with the practice community, please email us at info@5wishes.org or at any of us individually at the contact information that you see here on your screen. So thank you all for joining us and for your time today. And with that, I will hand it back over to Jennifer for the conclusion. And I'm not hearing Jennifer, so I will remind you that this webinar has been recorded. People asked about that. That may be Jennifer. I'm not sure.
Can you hear me okay?
Yes, we can now. Thanks.
Sorry, I must have been having a phone issue. So sorry about that. We did record the session, and the archive will be available within 7 business days. You may access that by visiting the 5 Wishes Practice Community page at 5wishes.org/practice and just look under webinars. And feel free to share the page and webinar link with your colleagues. On behalf of the 5 Wishes, thank you to our speakers and, of course, everyone for joining. Have a wonderful day, and you may now disconnect.